After undergoing cataract surgery, you will likely experience blur, floaters, and irritation for at least the first 3 to 4 days after surgery. These symptoms are most common in the first 24 hours. I do not expect clear vision the same day or in the first 24 hours after surgery. Visual blur can last longer than 3 to 4 days if there is significant swelling of the cornea or inside the eye that may require additional medication and time for recovery. You will follow up the day after surgery to check your intraocular pressure, corneal swelling, and the position of your lens. Most patients are doing well on the first day after surgery. However, there are 2 circumstances that occasionally occur and should be addressed. The first is elevated intraocular pressure, which can result in blurred vision and an aching sensation in the eye. This is almost always transient, lasting approximately 24 hours. It is typically due to some of the jelly material that stabilizes the eye during surgery clogging the drainage system of the eye. It is more common in patients with a history of glaucoma or elevated pressure. If the elevation is mild, you will be placed on a drop and asked to follow up in the next 1 to 2 days for a pressure check. If it is more elevated, we will perform a quick office procedure called a paracentesis to release a small amount of fluid from the eye. You will be asked to stay in the office for 20 to 30 minutes to check the pressure. If it has normalized, you will be placed on a drop and asked to follow up in 1 to 2 days for a pressure check. The other circumstance that can occur is a clouding of the shell in which the lens implant sits. This occurs because of the proliferation of microscopic cells that remain on the capsule following cataract surgery and can cause blurred vision. It can occur as early as 3 months after surgery and typically occurs within the first 2 to 5 years for the majority of patients after cataract surgery. When visually significant, this can be addressed with a procedure called a YAG capsulotomy. During this procedure, we apply laser to capsule behind the lens implant to create a central opening in the shell, which allows a clear view through your implant.